Hi, my name is Desmond Carson. You just don't know how excited I am about the opportunity to share with you the experiences I've had as an emergency room physician for the past 30 years, such that we can all be better educated about our health care. I don't care how rich you are, how many Porsches you have, how many Bentleys you have, et cetera, et cetera, et cetera. In the reality, health is your wealth. We know a few billionaires that have passed that would love to have their health as opposed to the money. So to that end, I'm going to share with you the experiences that I've had over the past 30 years in emergency departments, mostly emergency departments in inner cities, um, and tell you about the medical problems, the trauma problems, mostly medical problems that we all have unfortunately had to either witness from our parents, our family members, again, such that we can be better educated consumers as individuals when we go to and interact with the healthcare environment, our physicians, as well as the healthcare systems. So in brief, I am Desmond Carson. I'm an ER doc. I was raised in the East Bay of California, basically a little town right above Oakland, Richmond, which is a bare knuckle, gritty town. I'm proud to say that I come from this town. I would also state that I'm indigenous to this town. I went to local high schools here, public high schools, did what most people do in high school, played sports, went to parties, et cetera, et cetera, et cetera. But truth be told, I was always interested in math and science. And to that end, I pursued math and did pretty well in math. And by my third year in high school, this Jewish dude from UC Berkeley named Uri Treisman, he was recruiting kids to come to Cal for summer programs. And I was interested in doing so and applied to the summer program and was accepted at UC Berkeley to the summer program. At that time, I became interested in just going to UC Berkeley in general. And at the end of my senior year in high school, applied to UC Berkeley, was accepted, and attended UC Berkeley. When I got there, I continued in that light of science and had the support of a program, PDP, where we were all able to go through the various math and science classes, calculus, trigonometry, and vector calculus, as well as inorganic freshman chemistry, organic chemistry, pea chemistry. And by the third year, I started becoming interested in medicine. Chose medicine basically because my girlfriend at the time, who was a bioengineer, her cousins were physicians. And meeting these young people, they were 40s and they were doing the big things, as cardiologists, and his wife was a psychiatrist. It made me more likely to think that I can become a physician. To that end, I became a pre-med student, applied to medical school upon a graduation from UC Berkeley. See my nice new Cal Fresh sweatshirt I bought. Applied to medical school and was accepted to medical school. Started medical school, had troubles, trials, tribulations, fell on my face a couple of times. But to that, in that I was gritty and come from a town where we were used to getting knocked down and you just get back up. I was able to do that with the support of my community, which I remain close to now, as well as the young lady I met who was my girlfriend, who's now my wife. To that end, I applied, graduated from medical school in 1994 from the Medical College of Wisconsin, which is the affiliate of Marquette University. Upon graduation from Marquette University, the Medical College of Wisconsin, I applied to a residency in Los Angeles, the county hospital there, which was Martin Luther King Hospital. Martin Luther King Hospital, as soon as I say Martin Luther King, you all know which side of town that is. So it is the side of town, which is Compton, and it's right on the border of the freeway, the I-15, such that it is I-15 separates one side of town from the other, actually the blues from the reds, the Crips from the Bloods. As an emergency room intern, resident, the pathology that I saw, the diseases from the trauma, be it penetrating trauma to blunt trauma, since LA has too many freeways, there's always car accidents, to the disease processes of diabetes, hypertension, and in particular, what those diseases can cause. So, having did an emergency residency program for 3 to 4 years, graduated from residency in 1997, and was able to fortunately come back to my hometown, Richmond. And coming back to Richmond, I was became what they call an attending physician, i.e., one of the docs that you see when you come in the ER. I'm not an intern, not a resident, but I'm the guy who makes things happen when you come to the emergency department. I was blessed that I had a job right in my hometown of Richmond, such that I could serve. This has always been about the notion of serving. So I was able to serve there in that hospital from August 24, 1998. September 1998 to the hospital closed. Hospitals that have patients that are dependent upon public insurances, namely Medi-Cal in California, Medicaid outside of California, those hospitals tend not to do well financially. They tend not to have a surrounding neighborhood where there's a plethora of primary care physicians, such that patients have access to primary care. In the absence of access of primary care, the well-known diseases of hypertension and diabetes can cause a plethora of end-stage diseases, which is when people usually show up in our emergency department with end-stage disease, namely CHF, coronary artery disease, diabetic ketoacidosis, etc. To that end, what we're going to do today in this short time that we have as an initial start on these podcasts, for lack of better words, is start with what are the number 1 and 2 things that kill Americans. The number 1 and 2 things that kill Americans, and that's, of course, now that COVID-19 has took a back door to these number 1 and number 2 disease processes. And if you want to know my feelings about COVID-19, please look me up on Desmond Carson, CNN, and COVID. I gave a good shout out about how I felt about that process, that disease process, and all disease processes, whether it's a hangnail, whether it's diabetes, whether it's a urinary tract infection, stroke, or heart attack. The number 1 goal of all diseases is prevention. Prevention. We don't care what it is, whether it's cancer, whether it's bronchitis, whether it's pneumonia, prevention. Prevent first, early diagnosis 2, and then aggressive treatment 3. So, to that end, we're going to talk about the 3 diseases, the number 1 and number 2 disorders that kill Americans. Namely, we're going to talk about heart attacks and strokes. So, people who have heart attacks and or strokes, the number 1 reason why they have heart attacks or strokes is atherosclerotic cardiovascular disease, ASCVD. It is my goal to keep my language clear and compatible such that everybody can understand exactly what it is that I'm talking about. So atherosclerotic cardiovascular disease, ASCVD, is that your vessels, your blood vessels, have disease processing. ASCVD, and let me also stop and make a point that my language is bad, y'all. I forgot to tell you, I apologize to any pastors. I apologize to any women folk. I apologize to young people. My language is bad, so please excuse my language before we move on. Again, making it simple, and as we would say, straight 100, ASCVD is when your arteries are fucked up. If your arteries to your heart have disease, i.e. effed up, then that's what you have, coronary artery disease. If your arteries to your brain have disease, that's what you call cerebral vascular disease. So if you have disease in the arteries that go to your heart, then in fact, if the tissue that those arteries supply is to your heart is not going to get the nutrients it needs, mainly the oxygen. So the issue here, and what you would say was ask me is, how do we prevent ASCVD? And so then I would say and turn around and say that the risk factors for ASCVD, atherosclerotic cardiovascular disease, diseased blood vessels in your heart, or diseased blood vessels in your brain, is due to the major diseases that we already know. Hypertension, and everybody knows somebody with high blood pressure. Diabetes, everybody knows somebody with sweetness in their blood where they have diabetes. Everybody also definitely knows the one that I'm going to say that everybody knows that you're not supposed to do, and that's smoke. Everybody knows that cigarettes is a risk factor for atherosclerotic cardiovascular disease. And then the last one that we always hear of is the lipids, hyperlipidemia, and what your cholesterol look like. So between those four, namely diabetes, 2, hypertension, 3, hyperlipidemia, and 4, smoking, if you have those 4, you just increase your risk for atherosclerotic cardiovascular disease, i.e. the risk for diseased blood vessels, and as I said, effed up blood vessels, my daughter would get on me about that language, then that are the risk factors for ASCVD. And as I said, for the heart, it's called cardiovascular disease, and it's called coronary artery disease. For the brain, it's called cerebrovascular disease, and that's when people get strokes. So what is it that we need to do? We, one, need to talk about minimizing these risks. So the obvious risk, cigarettes, we knew before I went to medical school that cigarettes were called cancer sticks. And when I would go down the corner store, people would say, "Oh, cuz, sell me one of them cancer sticks." So we know that cigarette smoke is obviously one of the worst things you can do and one of the risks we have to eliminate. 2, diabetes. We need to make sure first we need to be able to try to not get diabetes, i.e. prevent diabetes, and then 2, early diagnosis of diabetes such that we can manage it aggressively. 3, hypertension. We know that everybody's heard about high blood pressure, and I know all the brothers is like, man, I don't feel like I got no high blood pressure, but that has nothing to do with it, how you feel. So in fact, we need to make sure that we, one, get screened for hypertension, get your blood pressure checked, whether you do it at the local pharmacy, whether you do it at the church medical fair, whether you do it because your auntie is an old nurse and has a blood pressure cuff. And then 2, be aware of the risk factors for diabetes. So the risk factors for diabetes we know are 1, type 2 diabetes, not type 1. Type 2 diabetes is namely obesity, because most of the type 2 diabetics are typically overweight. That's when I realized I had diabetes. It was from the symptoms of 1, either peeing too much, fatigue, your vision gets bad, and men, when you lose your strength down there, that's also a sign and symptom of diabetes. So you need to be screened for diabetes if you have any of those symptoms. And I mean peeing too much, peeing at night too much, having rashes on your genitalia, ladies included, rashes on your genitalia that's itchy, that makes you think that you got fungus down there. Those are the symptoms of diabetes. Hyperlipidemia is one of the things that your doctor has to screen you for. And basically that's a blood test. So we're going to take that blood test and measure out to see what your lipid panel looks like. Having said that, those are the big risk factors for atherosclerotic cardiovascular disease, which makes in the heart coronary artery disease, in the brain cerebrovascular disease, and those are the number 1 and number 2 killers of Americans. I guess we should briefly talk about signs and symptoms of a heart attack, then as well signs and symptoms of a stroke. To talk about signs and symptoms of a heart attack, we typically talk about in the male having chest pain, pressure, heaviness, or shortness of breath. If you have any of those symptoms of chest pain, pressure in your chest, it can even be just shortness of breath, like Richard Pryor said, I couldn't breathe. It felt like it was a weight on my chest and I couldn't breathe. If you have any of those symptoms, then in fact, those are the symptoms of a heart attack. You need to report immediately to the emergency department. I don't care about the hot link you ate and you thinking that it was just due to the hot link. I don't care if you think it was due to the indigestion of the steak you ate. If you have those symptoms, you need to go to the emergency department to be checked to make sure you're not having a heart attack. Are those all the symptoms? Of course not. People who have diabetes might not present like a man might present with just chest pain and shortness of breath. It might just be weakness. It might just be dizziness. So if you have these symptoms where you feel extremely fatigued and you just not know why you have it, you feel dizzy, that also might be one of the symptoms that can be consistent with you having a heart attack. Now on to the second high incident killer of Americans, which is strokes. We speak of strokes as cerebral vascular disease, again, the risk factors being atherosclerotic cardiovascular disease to the blood vessels that occur in the brain. So strokes typically come with signs and symptoms of the acronym that we have called FAST. FAST is face being twisted, your arms might feel weak, you might have slurred speech, you might feel dizzy when you're trying to walk, your legs might not move in the way that you want them to move. These are all the signs and symptoms of somebody having a stroke. To that end, you need to get to the emergency department right now, or as my dad used to say, RAT now, R-A-T now. Call 911 and get to the emergency department such that you can get therapy. Those being the number one and number two disease processes that kill Americans, heart attacks and strokes, with the risk factor, the number one risk factor being atherosclerotic cardiovascular disease, and again, the risk factors for effed up or diseased blood vessels being one, hypertension, and again, you guys got to get to either the church fair or to the Walmart or to your clinic or your primary care doc. And back to this primary care doc. I know a lot of us always say, I don't want to go see no quack ass doc. Find a doctor that you like. That is the number one. There's somebody out there that you like. It's a young brother who takes care of me named Pasha Jackson. Me and him are able to communicate. He gets 5 stars on Yelp. Young dude, played college football, smart, intelligent, got swag. He and I can communicate. Find somebody that you can communicate with such that you can talk to him about these problems. So one, make sure that you're screened for your blood pressure in one way or another, your primary care doctor, or at, as I said, the pharmacy, or at the church health fair. 2, if you have the signs and symptoms of diabetes, we need to have early diagnosis so you can have aggressive treatment. Those signs and symptoms, again, we pee too much, what we call polyuria. We pee at nighttime, nocturia, and I mean, you got to pee right now. Hell, I found out I had diabetes. We were in Hawaii, and going on one of the tours, I told the bus driver after leaving one of the volcanoes, you need to pull over, man, or I'm going to piss in your truck. That's just how bad the peeing is. You need to know you got to pee, as my dad said again, right now. So if you have those symptoms, polyuria, peeing too much, nocturia, peeing at nighttime, then you need to go see if in fact, or those rashes that I mentioned on your genitalia, unexplained rashes that are itchy, that's consistent with fungus, then you need to go to your doctor and make sure you don't have diabetes if you do aggressive treatment. Then the last but not least is hyperlipidemia that we spoke of as a risk factor for coronary artery disease, where they measure your lipid panels, and their doctor again should screen you for that last risk factor. And of course, get rid of them damn cigarettes. I think I've explained in brief that which I want to bring to the table. We will talk in gory detail about diabetes, as well as some of the numbers that we should measure on the next talking session / podcast, for lack of better words, where we talk about the numbers that we should be trying to reach, what we should measure, such that when you go to check the pressure in your tires of your car, There's a number you look for on the gauge to avoid, as my buddy Rick would say, to avoid your check engine light came on your body. We need to check these numbers. PSA, blood pressure, we'll talk about those numbers. We'll talk about what are the numbers you measure for diabetes. We'll talk about the numbers that you measure for the blood tests that you make. And so the next podcast, the next talk we'll have is we'll just talk about objective measures to make sure that you're in a healthy path. Because I know we all say, oh man, I can still bench press this much, run this fast, I get up and go to work, so I know I'm good. Well, the next podcast or the next talk, we'll talk about the numbers to ensure that you have some objective measures to see that you're good. Thank you for this short time, and I will speak to you in the near future. Thank you.